now.
Oh. Let's see, I didn't mean to do that. Can we edit that? We can't, can we?
I don't know if you can edit it or not. I mean, if you want to
Pause, okay. Does that work for you?
No, it's still a setting. I think
Yeah,
you might have to go through the menu, the host menu.
Mary, are you able to kind of tell them, are you on? Oh, she's on the attendee side.
I don't see an option to enable this one.
Video settings?
Yeah, that's just for you though.
Is it in my Zoom account?
Another issue too is Dr. Gehring is listed as not as a panelist, so he's not on. He's here, but he's not actually being viewed.
Okay, why don't we send the link to him? Dr. Cavallari, can you do that? And I'm going to call Mary to see how we could undo this video.
Yes.
Hang on 1 second.
Mhm.
I'm not sure that's Dr. Gehring's problem, though.
No, I think the host has to switch his status from attending to a panelist.
I'm not sure how, that's what we're looking for, and I can't find that.
Everybody. And they helped set up our transfer center for the state of Nebraska. So now that they're helping with the sequencing of the variants is just one of the few things that CHI has done. And our partnership, it's been a great partnership with them throughout this whole pandemic. So really appreciate all their help and all the help all the hospitals in Nebraska and hospital systems have done for us at the state. So I'll turn it back to you, Holly.
Cindy, you're on mute. Sorry.
Thank you.
No.
Dr. Renuga Vivekanandan is the CHI Health Chief of Infectious Disease, and you could share some of what you're seeing.
Yeah, thank you for the opportunity to speak this morning. As an infectious disease physician, been taking care of a lot of COVID-19 patients, infection prevention, vaccine efforts, and now one of our big concerns are COVID-19 variants. And if you look around US currently, multiple states are having increase in variants just around our neighbor, Colorado, California, Florida, Michigan. So it's more important now so than ever. It's really important for us to keep an eye on the variants in Nebraska. And it's really exciting that we can do this with CHI and Creighton. I think it's really important as we look at the numbers across the world when they're seeing UK variant, which is one of the big variants that we're seeing across the US. It's more contagious, infects younger population. So more so than ever, it's really, really important to get our vaccine. It's wonderful. Now the vaccine is opened up to 16 years of age and older. So it's really, really important for us to get our vaccines and continue to wear the masks and hand hygiene and all the tools that we do have so we could keep the numbers down. As I am looking at our state numbers, a positive rate is tiny bit going up. It's about 5.7. So, and Douglas County is about 7% or so. So slightly a little bit of increase, but we have done a wonderful job in Nebraska starting in November, December when we had our surge. Work together, doing all those good tools, wearing the mask, hand hygiene, and now we even have a better tool. Please get your vaccine. And thank you for the opportunity to speak. I'll pass it back to Cindy.
Thank you very much. Next up, I'd like to introduce Dr. Michael Belshand, Professor of Medical Microbiology and Immunology at Creighton University. He's also a medical virologist, and he can talk about some of the research he's been doing and some of that.
Thank you. So yes, I'm a classically trained virologist who prior to COVID-19 worked on HIV. but immediately last April, when we saw this coming, switched to solely basically focus on COVID-19 since the beginning. And we really on the fly assembled a team, and some of them you're seeing today, some are not with us today, to begin examining both clinical or both patient and viral aspects. I'm more on the virus side, not on the clinical side. And so the sequencing project, which we really initiated back in April, and we have been tracking the virus since then, has been a very one of the more important projects that's going on to be able to identify virus evolution and track virus evolution in our region specifically. You know, there's a lot of sequencing going on the coast and at bigger institutions, but here now we have this capacity to do this high throughput sequencing and really sort of look at our region specifically and analyze the virus. And with that, I'm going to introduce my compadre, as I would like to say, Holly. She and I work very close together, and she'll talk a little bit more about the sequencing. Holly?
Great, thanks, Mike. So I'm Holly Stussman. I am an assistant professor of pharmacology and neuroscience in the School of Medicine at Creighton. And so I call myself the oddball of the group because I do not have a virology background. In fact, I'm a human geneticist by training, and I specialize in sequencing techniques. And so when Mike approached me, I think, he said back in April, we actually mean April of last year. We started this project as soon as COVID was really hitting the US. And he approached me and said, hey, you know about sequencing, can we maybe get this project off the ground to look at variants? And I have to, give some kudos to the School of Medicine. They actually provided some funding for us when there was no federal funding available to start variant tracking very early before it was a really big interest in the United States. So we've been doing this for almost a year. And the great thing is that we were able to kind of leverage techniques that are used really commonly in the human genetics world to attack this problem. And so I think that's been a really great advantage of a really fulfilling use of technology and being able to use that to attack a public health crisis. And I know that Dr. Tierney and I have talked about a fair bit that a lot of the sequencing capacity actually exists in academic institutions rather than at the state level. And so it's also been great to kind of use that ability that we have at academic institutions to meet this head on. We also have taken advantage, we've been really lucky that there are large international working groups that have developed methodology for working with COVID very early on. And those are the groups that have also worked on Ebola and Zika viruses. And so using that technology again to apply it very quickly to work on COVID in real time has been incredibly fulfilling. And I'm glad that we are able to help, at the state level now with doing that variant detection in a very systematic way. I think it's going to very positively contribute to how we fight the virus going forward. So thank you for the invitation to speak today. I'll introduce Rich Gehring. He's a professor and chair of the Department of Medical Microbiology and Immunology in the School of Medicine.
Thanks very much, Holly. I want to make a comment or two about the variant detection, because that's really why we're here. That's the major thing that we're all concerned about and that we're focusing on, especially today. What is the deal with variant testing? And the important point to make here is that looking for variants in an infectious disease setting is nothing new. And in fact, it's something we've been doing for decades. We've just switched now to concentrate. We haven't given up looking at variants for a variety of infectious diseases, but we're focusing obviously on COVID because of the current pandemic. So what are we really doing? As you've already heard, we and every other lab and organization that's involved in this is sequencing, looking at the sequence of the viral chromosome. Let's call it the viral chromosome. And it's important to underscore that the chromosome is the most fundamental molecule of identity in the cell, or in this case, in the virus. So by analyzing that molecule, we are learning about the fundamental identity of that infectious agent. And so the sequencing is done, and here we have it. And now what do we do with it? And the answer is, well, we look for changes. Well, changes relative to what? What's the foundation on which we base those changes? And that foundation is the original sequence from the early Wuhan virus that was isolated. So everything is compared back to that, and we look for changes. Now, that's not a small feat because the viral chromosome has 32 elements, 32,000 bases, all right? So that's a lot of data to scrutinize and to try to do analysis on. And we have very sophisticated computer programs that help us to do that. And so the sequences that we generate, we align, we have with the original viral sequence. We have a computer programs that help us to do that, and they very quickly look for changes. Those changes are then identified, and they constitute a fingerprint, and we compare that fingerprint to the known fingerprints of the variants of interest and the variants of concern. And we have the capability here to do that very quickly, so that if we sequence, let's say 100 isolates or so this week, within less than a day after we have those sequences by computer analysis, we're going to know if we have variants of interest or variants of concern. We identify those locally, but as Dr. Stessman has mentioned, we're very fortunate because there's been immense global participation and cooperation in fighting this pandemic. And there are global databases that we can send our sequences to, compare our sequences to confirm that we're making the right call. And we do that. One of the best known sequences now has over 1 million COVID sequences in its database. And so we make those variant calls here, but we also quickly send them for comparison with the international, the global database to confirm that we're making the right call. And so far, we've never been wrong. So we're very proud of the fact that what we're able to do quickly, we're able to do accurately, and we can find and identify those variants that are of concern to everyone. Thanks for the opportunity to talk. And with that, I'll pass things on to Dr. Stephen Cavallari, who's our Technical Director of Microbiology at CHI Health.
Thank you, Dr. Gehring. Good morning, all. So yeah, I'm a clinical microbiologist by trade, and along with my colleague, Dr. Joe Konezatek, who is director of the molecular lab here at CHI Health, we began COVID testing over a year ago, and it performed now over 125,000 tests. So as you heard Dr. Belshand mention, shortly after we started doing testing, we had a conversation between the two of us about maybe collaborating with the researchers at Creighton on doing COVID research using our lab's positive samples. So along with Dr. Stessman and the group at Creighton, this research really has been going on for like you've heard over almost a year now. So when COVID variants were initially observed, the first thing we did in our diagnostic lab was determine that all of our COVID tests were actually capable of detecting these variants, and we found that they were, although the test could not identify the positive sample as having a variant. So that's where further analysis is now needed. So with this new collaboration, these recent positive samples are sent to Creighton for the variant analysis that you've heard described, and it's done in a real-time manner, as Dr. Gehring indicated. And then once this analysis is completed, we get that information back from Creighton as to what of the samples contain variants. So then what we do back in our lab is add back the patient demographic information to each of the specimens on the list, and then send that to the public health department for contact tracing and follow-up. So that kind of completes the circle. And it is hoped that the collaboration between CHI Health Laboratory and Creighton will be assistance to the health department in mitigating the further spread of the pandemic. And with that, I'll turn it back to Cindy.
Thank you very much, Dr. Cavallari. Dr. Maureen Tierney, I would like to send it back to you for a quick summary before we open up to questions.
So just to give you an idea of some of the magnitude and where we are in this process. So there are 3 places in the state right now that are assisting DHHS with variant detection. The Nebraska Public Health Laboratory, a laboratory at the UNMC College of Public Health, and now the Creighton Laboratory, as you've heard, in conjunction with CHI Health. There's going to be some new numbers coming out today, but as of yesterday, there were over 180 variants that have been detected in the state of Nebraska. Approximately a third of those have come off runs at Creighton from the CHI positives that went through there. And of the variants that we've seen, the majority have been B117, and there seems to have been a movement in an early run to a later run of an increasing percentage of those. So we're following the rest of the country in terms of an increasing percentage of B117 being seen, but we've also seen some California variants. So we really think these three institutions are really going to help in the control and detection of variants because it's a key time. Cases have gone up over the past week, 100 hospitalizations in Nebraska to 148 yesterday. So we need to keep vigilant with all the NPIs and especially with vaccination. So thank you so much for attending today and for listening to our experts. And I'd like to thank Drs. Belshan, Stessman, Goring, and Cavalieri. Dr. V and I would like to thank them for their expertise that allows this to happen.
Okay, I do have a question that has come in. Are we still confident that current vaccines are effective against the variants?
Yes, we are. I think there's extremely good data that for the B117 variant and for the California variant, that the vaccines that are available are still very effective. I think the one strain that there's still concern about as of this point in time, and there's also some efficacy, although perhaps slightly reduced for South Africa, the South African variant, but it's the P1 variant that's been seen primarily in Brazil, where we're still a little concerned as to what vaccine efficacy is going to look like. But for the overwhelming majority of variants that are seen in the United States right now, the vaccine still has very good efficacy. Would you agree, Dr. Vivekananda?
Yes, definitely. The studies that are coming out are definitely showing the vaccines are very effective. Currently circulating variants, and the especially what we call the UK variant, and that is one of my big concern is that variant will be predominant in the United States soon. So more so than ever, this is one of the big reasons that we have to get vaccinated and wear our masks. And I would also think want to clarify. I'm sure you guys are thinking, how do we get the samples? So Dr. Cavalieri gets all the COVID-19 testing from CHI Health hospitals, clinics, and then he takes those samples and gives it to Creighton, to Dr. Belshan to test those for variants. So I think doing that work is really important for us to take our samples, positive cases, looking for variants, because now so more than ever, we have to do contact tracing and keep the numbers down. And so again, masking and wearing, getting a vaccine is going to be really, really important.
A question here about the state-of-the-art sequencer. How long has the sequencer been used?
Sure, I can take that one. So this sequencing technology, we've been running on this platform since probably June of last year. It's not a brand new platform, but it is still considered a next generation sequencing machine. So the nice thing about it is that we can run many samples at once, which is a huge advantage over some of the older sequencing technology. So right now we actually can run all 100 samples at one time through the sequencer and then pull that data back apart into individual samples in the data analysis. So that's the big advantage. And actually we do have the capacity to do more samples than that. But right now we're pretty much sampling all positives coming from CHI every week with that capacity. So it's pretty great that we can do things so quickly and in such a high throughput way. And that's really been the advantage of the technology.
Thank you, Dr. Stessman. And also one thing, Maureen and Dr. Vivekananda, maybe we can talk about the importance of this partnership with CHI and Creighton and the state?
Yeah, I could start. This partnership with CHI, Creighton State has been going on for a long time. CHI and Creighton, just like Dr. Anton was saying, we started helping out really, really early. We serve CHI Health, we serve almost half the population in Nebraska, very wide reach. So we have been using evidence-based studies, making sure we treat our patients appropriately. So collaborating with academic and clinical medicine to deliver the best care for our patients. So this has been going on for a long time, and I'm so excited now that we can collaborate again, bring us, with the partnership, we could do this variance testing as well, because it has a huge impact public health wise to be able to help our community, to make sure the variants stay low and we keep the infection rate low. Dr. Tierney?
As many of you may know, I was actually at DHHS for 7 years before I started at Creighton last summer. So I'm a public health expert and epidemiologist by training. And it's in this kind of setting where basically everybody has to help out. This has to be a statewide, every brain in epidemiology and public health and clinical medicine and laboratory medicine have to pull together. And I think that's been really evident where UNMC and Methodist and Bryan and CHI Health and Creighton have really all participated and contributed to this effort. And I think that you all bring what expertise you can. So with now more epidemiology experience at Creighton, as well as the virology expertise that's extraordinary, I think, in Drs. Belshand and Coring, that, for us to be another part of detection. And I saw, if it's okay, Cindy, with some of the questions going on in terms of, so the sequencing and the capacity for that's been going on for a while. Doing it with the specimens supported by the state contract has only just been a few weeks, with the most significant results coming off in the past week. It's actually extremely expensive to do this, and so it's wonderful to get some additional funding and to be able to provide DHHS with this additional data. One of the other things is by doing, and hopefully we won't get to the point where we have so many positives that we can't do all of them. But right now, since all the positives from CHI Health in Dr. Cavalieri's lab, so in this area, since all of them are being sequenced, it gives us an idea of what the percentage of circulating viruses in the community in terms of what percentage of those are variants. And that's a very, in addition to detecting particular variants and controlling those, it's also good to know where do we stand in terms of what percentage of the total virus is a variant strain.
One of the questions, go ahead. Okay, Julie Anderson is asking Dr. Vivekanandan, the types of patients that you're seeing. You said younger, kind of, what is the age group? And are there more hospitalizations?
If you look at the DHHS website, we slightly see a hospitalization going up a little bit. There's more data to come, so we will have more as we look into that. But personal experience, as I am taking care of patients with COVID-19 infection, I am seeing a younger population. I think that's one of the big concerns, less than 60 years of age, more so than before. So it's more than now important to get the vaccine. But as far as the breakdown, we don't have that data yet for the whole state, but I am sure that'll follow soon. Would you agree, Dr. Tierney?
Yes, yes. It's definitely a concern of all the ID clinicians and public health docs that the number of younger folks who are requiring critical care seems to be increasing. And that's of great concern to us all.
Any other questions that haven't been addressed?
I just wanted them to talk a little bit more about the information with these variants. Will that be released to the public? So will the public have a better idea of what variants are circulating because of this partnership?
You know, Dr. Anthone and Dr. Matt Donahue from DHHS are, report and pull together the variant data from around the state. And, every variant case is looked at very closely in terms of potential source. Was this someone who traveled? And as they say, gets significant priority in terms of contact tracing. So the percentage of, what kinds of variants we're seeing, and I'll let Dr. Goring and Dr. Belshan perhaps talk about some of our recent data in terms of general percentages of B117 versus California variant.
Any other questions that I see, Dr. Stessman, you're.
I was gonna, yeah, do Dr. Belshan or Stessman or Goring want to just relate the sort of general percentages of the variants we're seeing?
Yeah, overall, we've seen an increase in the B117. One point I would like to make about the B117 is there are two flavors of it. There's a specific mutation that is thought to make the virus more infectious. It's this E484K mutant, which I know is meaningless to everyone. And that actual mutant we are not seeing. So we're seeing sort of the more general form of B117, and it is becoming, at least in the sampling we've done, as far as the reporting aspect of it, that is completely will be on DHHS and on their time schedule. We're not going to directly report. We report to them, and then they report to the public, so to speak.
Yeah, we can report just like Dr. Tierney said that we have identified now, or you guys have identified, and Public Health Lab identified over about 180 variants right now that have been able to be sequenced successfully. And of those, the vast majority, 140 of those 180, have been the B117 variant. And then we'll have more specific data as we get more analysis of those, and we'll be reporting that as we get that data.
Also, I don't know if we've actually clarified, but B117 is the UK variant. So when we refer to them, they're interchangeable.
One of the things that we do, I noticed a chat comment earlier also about B117, and Dr. Belshan's right. I mean, you do have the two flavors. There are several of these variants that are now coming in two flavors. There's sort of two variants of California. There's two variants of the UK, one of which carries this unique fingerprint called E484K, which, as Dr. Belshan said, doesn't really mean anything to probably to the general public, but it's part of the fingerprint signature that we look for. And then now in the news, we have this so-called new double variant. There's talk in the news about a double variant there. What they're talking about is the California variant that would actually be a third California variant because it's now picked up the E484K signature. But one of the things we do immediately when we get the sequence data is to just tell the computer program, look for E484K. Just look for that right off the bat. And within minutes, we know whether or not we've got anything at all that we ought to give special attention to before we look at things as a whole. And we just don't see it. It's just not here. So we have the standard UK variant, the so-called B117, that's its fingerprint name. We have the California variant, not the double variant, but the old-fashioned ones. But they're in a minority. It's as everyone knows, and as Dr. Anthone has also nicely summarized. Yeah, the regular B117 is now predominating. It's moving up.
Any other questions? Oh, I see there's a couple more that came through. Are there any other questions that haven't been addressed? What hope is there that these variants continue to multiply? Will we be able to return to society as normal in terms of masking and distancing? And will variants eventually stop appearing?
Oh, go ahead,
Oh.
Mike.
I was going to say the truth with almost all RNA viruses is that variants will always exist. The concern is when you get variants that either, number one, evade our immunity, being the vaccination or natural immunity, and then of course variants that transmit easier and become spread within the population or cause more severe forms of clinical disease. So we will always have variants. The important part is that what we're doing is keeping the surveillance for variants of concern, and trying to identify those, do contact tracing, and get, hopefully get them out of the population as quickly as possible.
I think that everybody on this call, media and the experts sort of know this because you've been hearing it and reporting on it so frequently, but the major issue to control is to prevent a virus from getting a host, because if it can't get a place in a host, it can't multiply, have the chance for, production of mutations that leads to variants and then spread to somebody else. And so that's why in absence of a vaccine, the only things we really had in that setting were all the non-pharmaceutical interventions, masking, social distancing, avoiding crowds. The vaccine is the most important, tool in that armamentarium, but the others really supplement because, no vaccine is 100%. And so even with vaccination right now, we still want to be cautious in the cases where somebody might have a breakthrough. And but it's by continuing to not allow a virus the chance to multiply, the chance to have a host, that we have the opportunity to reduce the number of variant transmissions. So right now we're in a race against variants by pushing vaccination as quickly as possible.
Julie Anderson, you had a question?
Yeah, sorry, I'm confused here. Are you folks saying that variants now are dominating the cases in the positive cases in Nebraska?
So, Julie, we don't 100% know the answer to that question because, if you look at all the cases and how many are actually getting sequenced, I think the thing that we can say is of the last run that was done at Creighton, the majority of those were B117. Am I correct in saying that, Drs. Goring and Belsham assessment? Okay.
Yeah.
So that we can tell you whether or not they're the majority of the circulating virus, we don't know for sure.
Thank you for clarifying.
But they certainly will be, I think, within the next few weeks if they're not now.
Okay.
If I could just add one thing here, and that is that, the governor and the state, we've always concentrated initially on getting the most vulnerable population vaccinated to prevent hospitalizations and deaths. And now we're able to get all of the population vaccinated. And they're the ones that are actually the ones that spread it even more than the elderly or the vulnerable populations. So if I can just put in a plug for vaccinate.ne.gov to sign up for all those people now that are able to get vaccinated, please do that. And just like Dr. Tierney said, this is what's going to stop the spread of those variants. Right now, we have these successful vaccines that we didn't have back in November. So it's our new weapon against this. It's what gives us hope for the future so that we don't have to wear masks and do NPIs forever. So please, even though you're young and you might think that you're not vulnerable to being hospitalized or dying, it's still important to get vaccinated for that purpose, to keep the spread under control. So that's just my plug for today.
I just wanted to come in and get clarification on what Dr. Tierney just said a moment ago. Are you saying that the majority of positive cases that Creighton is getting are B117 variants?
So in the last week. And I'm looking for, I don't know if Dr. Stessman or Belshan want to make sure, let me just make sure I'm correct in this statement. So of the last group that was run, which would have been specimens collected in the prior 1 to 2 weeks, that were the majority of the positives from CHI Health. And they say the majority because not all specimens can be sequenced for technical reasons, not for sort of other reasons. The majority of those specimens that we saw were B117.
Right.
Is that correct?
Yes, that's correct. But yeah, the caveat is that that's 1 week. So, you know, as scientists, we always want to see the trend over, you know, the course of several weeks. You know, the same thing with when you don't really like to look at daily cases, you want to look at that 7-day average moving. So, but yes, it does appear that the B117 is becoming more prevalent in our region.
I think it's also important to think about the samples that we would receive that are positive are people who suspect that they might have been in contact with someone or are actually experiencing symptoms. So a lot of times that doesn't always get asymptomatic carriers. So these are people that have symptom presentation. And so I think that's also a piece of this that we have to consider of who we have a sample from and thinking about that piece as well.
Thank you, guys. And I promise this should be my last question here. In terms of when it comes to that B117 case, and you guys might have touched on this earlier, but are we seeing, do you guys have any data on how many of those cases are coming from people that are 16 and under? I was hearing the other day that the UK variant does spread more quickly in children. So do you guys have any data on that?
That is data that is actively being looked at right now by Dr. Antone's team. And so we don't actually know that as of this point in time, but I know that that information should be coming out with, I would say probably within the next few days to the next week, but trying to figure out by age, by hospitalization, by severity, a whole variety of parameters. They'll be looking at that.
Thank you so much.
One more quick one if you guys have time. Dr. Tierney, you mentioned earlier on that there might be new data coming even today that would update that 100 case count, which is still way ahead of what's on the CDC website. Do you know when that's going to come out or how we can get it?
I'll answer that, Maureen, and I would say I would stay tuned for that. Like Maureen said, we have Dr. Matthew Donahue and his team working on putting all that data together, and we should be able to have it for you shortly.
Thank you.
Any last questions? Then I want to thank everyone for joining us today. If you have anything that you need additionally, please contact me, Cindy Workman at creighton.edu, and I will see if I can get an answer. So thank you very much, everybody.
Thank you, Cindy.
Thanks.
Thank you.
Thank you.
To everybody.
Yep. Thank you.
Thank you, Cindy. Will you be sending us this recording?
Yes, I will.
Perfect. Thank you.
Bye.